Hey guys, Dr. John Mark Chesney here. I'm owner of Simply Physio and a licensed physical therapist. Today we are talking about the top 5 causes of patella-femoral knee pain or runner's knee. So the patella is the kneecap. So we're dealing with pain here in the front of the knee. And this is a condition. The first tip or cause of patella-femoral knee pain is understanding the joint itself. And the kneecap floats here on top of the knee, so it can shift medially or laterally. So typically what happens with pain is the kneecap will be positioned a little bit more laterally. And there's a few reasons why that tends to happen, but the kneecap will sit, and when it sits right more laterally, then as it goes in the groove, as you bend and straighten your knee, if it rides a little bit more laterally, it starts to add friction and tension and stress and can eventually become inflamed. So that's the first cause. And so now we're gonna get into the causes of really why that happens. So we'll start from the ground and kind of work our way up. So the first one that will influence that kneecap position, so really tip number 2, is what's going on with the foot. And if you have excessive pronation, so pronation is the arch collapsing or kind of rolling in, what you'll see if you kind of watch my foot and my knee, as my foot rolls in, the arch flattens, go into excessive pronation, the knee will roll with it. When the knee rolls with it, the kneecap actually will ride a little bit more to the lateral side, so that as you bend, as you walk, as you squat, with that foot position, it'll add more tension and stress to the kneecap. So that's the second one to be mindful of is what's going on with your foot, and is your foot collapsing into excessive pronation. So the second tip is what we call tibial interrotation. So the tibia is the shin bone, and this goes along with excessive pronation. What we'll see is someone will have a lack of the ability to rotate in. So I'm doing this motion. A few things about this motion that you can test for. We want your ankles under your knees, and we're looking to keep our feet flat, and we're seeing how well can I rotate in. And if you watch my knees, I'm not going in like this, so I'm trying to keep everything still, and it's just this pivoting of the shin bone and the foot coming in right here. The other thing where people will cheat is they'll just kind of bring the knees out or kind of tip the feet up. So I want my feet to be flat. And so what we're looking for is a side-to-side difference. And usually the side that you're gonna have excessive pronation will also have a lack of ability to rotate in. So usually around 15 to 20 degrees is a good amount of motion, but you really have to be mindful of that you're doing this test correctly and you're not cheating. Or if one side you have to work harder to get into internal rotation, then that's a sign that that's a movement that you need to improve on. So we're coming up the chain. So now we're gonna go above the knee and really to the hip. So this will present itself oftentimes in when somebody's squatting. Really all these components can add together. So, but we start to see it is if I start to do a squat, if my knees start to come in a squat, that'll be influenced by the foot mechanics, what we talked about, the tibial interrotation, and or the hip here. So this position, it can be any one of those 3, or primarily could be coming from one area. So the area we want to be concentrating on is how are the hips activating. If we don't get good hip muscles, then the knees tend to come in. So we want to think about kind of pulling out, which is a lot of muscles working here, but a lot of that can be driven from the hips as far as strengthening the size of your hips so that your knees aren't diving in when you're doing a squat or maybe stepping down a stair or landing from a jump. If you're doing this, you're gonna have excessive pressure there on the knees. So the fifth thing to be mindful of that can contribute to causing patella-femoral knee pain are your training habits. So even be mindful of, like again, a squat position. It may be that you have weakness in these areas, or it might be that you just need to be mindful of if you're squatting or doing a barbell squat or anything with weights, the more that you're adding, watch the position of your knee, because you very well can just be pressing out. Kind of think about driving out with the knees as you're going down deeper, so that you're not getting into that position. So just being mindful of that. The things, training habits, body awareness, can even go into, like, if you are a runner, being mindful of, are you doing excessive hill training or stairs? You're maybe doing stadium steps, those types of things. That puts more pressure on the knee. And if you have these other things that are off, then excessive training that puts strain on the knee can create an injury or an irritation. So guys, thanks for tuning in. If you like the content, if you've enjoyed this, be sure to like our channel and subscribe to what we're doing here. Thanks for tuning in.